Let's talk about Dr. Melfi.
Know what I'm figuring out lately? Talking helps. That's right. That's right, he's right.
I understand that some things were purposely inserted into the story in order to make the doctor-patient relationship more thrilling, more scandalous, more dramatic. So I wouldn't have expected it to just be a regular, smooth, completely professional relationship. Wouldn't be nearly as exciting, right? So, with that said, here's what I believe Dr. Melfi got wrong while treating Tony Soprano as a patient. FYI, when I say things she got wrong, it could be advice she gave Tony, meds she prescribed, decisions on restarting or ending their doctor-patient relationship, or her evaluation of certain topics or things that Tony's brought up in therapy at one point or another. First step.
What line of work are you in?
Waste management consultant.
You said you were in waste management.
The environment.
Dr. Cusimano, besides being your family physician, is also your next-door neighbor. See what I'm saying? I don't know what happened with this fellow. I'm just saying.
So right off the bat here, Dr. Melfi's implying that Tony makes a living dishonestly, or that he has something to hide regarding his finances. In other words, her question was, how can you afford to live next to a doctor in this upscale suburban neighborhood? You must be doing something shady to be able to afford that mortgage while working as a waste management consultant. First off, since when were consultants automatically cash-strapped? And even more importantly, since when is a therapist supposed to make a patient feel that way on the first appointment with those sorts of questions? Whether or not your patient is Tony Soprano or any other human.
We had coffee.
Next.
How long did the attack last?
About 30 seconds. Was dizzy, out of breath. That's it, though. I never lost consciousness.
Anything since? I'm gonna write a script for Xanax, just for a couple of days. It'll get you over this short-term stresses.
Short term, huh? 7 years later. How are those short-term stresses going, Tony? In the words of a wise man named Hesh Rabkin, there's good and there's not good. This is not good. Xanax can also lead to nasty physical withdrawal symptoms if someone suddenly stops taking it, so the danger here with that would likely depend on how long Tony takes the meds. Also, speaking of meds, how long did Tony actually take Prozac? It's mentioned on and off, but we never know for sure, and SSRIs can also be dangerous if a person suddenly stops taking them after regularly taking them. Was Dr. Melfi properly monitoring Tony and his regimen with the various medications she prescribed him? Xanax? Prozac? What about lithium? Whatever happened there? Next.
The judicial system has gotten much better in dealing with sexual predators.
Oh, yeah.
I think it's quite an understatement to say that this statement by Dr. Melfi does not age well. Particularly the one that she makes in Season 1, Episode 9, Boca, to Tony about the justice system getting much better in dealing with sexual predators, because they surely did not deal very well with the sexual predator named Jesus Rossi.
This is Dr. LaPena. I'm calling for Jennifer Melfi. The rape. Right, Detective Pearsall was going to call when you were ready for us to come down for the lineup. What? Why not?
What's going on?
Well, why? I mean, that's absurd. That's ridiculous. Mishandled the chain of custody, so they had to let him go.
What chain of custody? They let him go?
Somebody misplaced the evidence kit for a little while or something. I don't know. It's a legal thing. I think they just have to let him skip.
And in a moment of pretty bitter and cruel irony, Dr. Melfi does end up seeing him in a lineup. Well, not in a lineup, but she does see his face while waiting in line at a restaurant. Next.
Was it a genuine suicide attempt, or was it a suicidal gesture?
How exactly was Tony Soprano qualified to evaluate whether something was a genuine suicide attempt or merely a suicidal gesture. I mean, when Gloria mentions an ER doctor telling her that she was just having suicidal ideations later on in season 3, after we meet Gloria, Dr. Melfi questioned whether or not that ER doc was, quote unquote, qualified to make that diagnosis. But she thought Tony was qualified to do so? Very similar issue. Next.
Are you still taking the lithium?
Lithium, Prozac. When's it gonna end?
We're trying to give a jolt to your system.
The easiest land you could breathe.
What was the reasoning behind Dr. Melfi prescribing Tony lithium, given its primary use in patients with bipolar disorder? Tony was never diagnosed with bipolar disorder, and Dr. Melfi never really explained her justification for prescribing Tony lithium in the first place, particularly when he was already on Prozac and Xanax. Next.
Suicide is something I take very seriously.
Well, the doctor in the ER said it was only suicidal ideation.
Is he trained to give those diagnoses?
So who is qualified to make that kind of diagnosis? Tony regarding his daughter's friend Allie, but not an ER doctor talking to Gloria? Next.
After everything we've shared in here, you're cutting me loose just as my son got out of the hospital for trying to kill himself?
But you are in crisis. I don't want to waste your time.
As a doctor, I think what you're doing is immoral.
Dr. Melfi says she takes suicide very seriously, but she cuts off a patient of 7 years immediately following that patient's son's hospitalization for a suicide attempt, not to mention one that Tony directly experienced and was part of himself. So that's additional trauma layered on top of just the fact that his son attempted suicide. And Dr. Melfi surely knows from her 7 years of treating Tony that he's also mentally unstable with major emotional and behavioral issues of his own. It seems she really let peer pressure get the best of her here. And also, when you think about it, Elliot should not have known that Tony was her patient anyway. That was an accidental slip-up when she mentioned his name all the way back earlier in the series. Next.
Thinking about taking my patient back.
It's a serious decision.
He's my responsibility. Elliot, I abandoned him.
So this scene where Dr. Melfi tells Elliot that she's thinking about taking back Tony as a patient is in season 2, episode 5. I wonder if she feels the same after the Blue Comet, assuming, of course, that we're in a world where she continues to see Elliot. Something to think about.
I think seeing him again will be very therapeutic for me.
It's not supposed to be therapeutic for you. This is your therapy here.
Perhaps Dr. Melfi shouldn't have taken Tony back as a patient in the first place. But now she's abandoned him again. Next.
It would be like committing an act of symbolic incest.
Whatever. Like, what am I gonna do? I got lucky the first time because I was able to control myself, but you only get one of those.
Rationalizing. I can't control myself. You can.
Even if I want to fuck her brains out.
This is a milestone for you. You're at a very important crossroads.
Some call it the precipice of an enormous crossroad.
For once, you want to avoid doing something you know is wrong and would be destructive both to yourself and to the people you care about. That's growth. That's progress.
Milestone? Growth? Progress? That's what Dr. Melfi seems to believe here. But it's more like luck of the draw, with Phil knocking on the door, just as Tony and Adriana are about to kiss. But Melfi really seems to fall for it here.
get your towel?
No.
Phil's thinking to himself, whatever happened there? Finally, that's all for now. If you ask me again in a couple of 3 months, this list may be different, but that's the beauty of The Sopranos. My perspective can evolve and change, or sometimes not. In the meantime, what do you think? Are there other instances where you feel Dr. Melfi got it wrong? Thanks for watching. I hope you enjoyed this latest video.